From inadequate mammogram services in Tamale to unaffordable radiotherapy in Accra, breast cancer patients face vast challenges. The Breast Society of Ghana, however, is pushing for swift action in diagnosis and treatment. Speaking at the 6th Annual General and Scientific Meeting, President of the Society, Dr. Josephine Nsafo, highlighted major gaps in access and affordability of care for breast cancer patients in regional hospitals across Ghana.
About almost 2,000 people died from breast cancer, which is a bit too much. About 70% of cases in Ghana are advanced breast cancer, stage 3 and stage 4. And perhaps they maybe do not get the best as in early disease for a number of reasons. You know, even physical or geographic accessibility. Our health facilities are not equally distributed. They are not equally stocked in terms of infrastructure to treat breast cancer. Accessibility even can also be financial. We know that certainly there's some out-of-the-pocket payment. So we believe that we will come up with ways and suggestions and draw a roadmap as to how things can be physically, financially available to all patients with breast cancer.
The northern region, some of the challenges we face through breast cancer journey is that Tamale Teaching Hospital doesn't have a mammogram machine, and then and so sometimes we have to go outside the hospital to get it, which is a little bit expensive. Another thing is that there's no radiotherapy center in northern region. Of course, we have one in Konfanochi and then one in Kolebu, but then we have to travel all the way to Konfanochi or Kolebu to have a radiotherapy done. There are no places for us to sleep. Sometimes some sleep outside the hospital premises, which of course is not good for our mental health.
On her part, Deputy Minister for Health Dr. Grace Ayensu Dankwa outlined measures to address the gaps in diagnosis and treatment. She assured that where the National Health Insurance Scheme falls short, the Mahama Cares Initiative will step in to provide financial support for patients who apply.
Once they get to that stage, now the next of a government policy kicks in, which is the Mahama Cares, which is the Ghana Medical Trust Fund, so that when they start and the national insurance is not enough, national health insurance is not enough, they can access this fund for the rest of their treatment. For instance, we talked about radiation therapy. Some of them will need surgery. Some of them will need chemotherapy. Most of those medicines are not covered by the National Health Insurance. So the Mahama Cares, which is a Ghana Medical Trust Fund, will kick in and people can apply and access that fund to take care of their needs.